Imagine walking into a doctor's office in 1850 with a mild cough and leaving with a prescription for chloroform, cannabis, and a light dose of arsenic. Welcome to Victorian medicine, an era where the treatment was routinely far more dangerous than the disease. Before germ theory revolutionized science, doctors relied on guesswork, toxic chemicals, and quackery to cure everyday ailments. Take Mrs. Winslow's soothing syrup, for example. In the mid-19th century, parents desperate to quiet teething or crying infants turned to this popular patent medicine. The secret ingredient? A massive combination of pure morphine and alcohol. While it certainly stopped babies from crying, it did so by putting their nervous systems into a dangerous stupor. Untold numbers of infants suffered from addiction or fatal respiratory failure, earning the product a grim nickname, the baby killer. Yet, opiates weren't just reserved for children. Adults were regularly prescribed Batley's sedative solution, a potent, unregulated concoction of opium, alcohol, and sherry. Marketed as a harmless cure for headache, anxiety, and insomnia, it quickly led thousands of unsuspecting Victorians into severe chemical dependency, with accidental overdoses occurring daily. For adults looking to improve their health or appearance, doctors turned to heavy minerals like arsenic. Fowler's solution was a wildly popular tonic made primarily of potassium arsenite. Victorian beauty standards prized pale, clear skin, and small doses of arsenic were marketed to eliminate blemishes and give women a radiant porcelain glow. It was also prescribed internally for anemia, asthma, and digestive issues. Over time, daily consumption led to chronic arsenic poisoning, causing painful skin lesions, internal ulcers, paralysis, and severe organ damage. If that wasn't enough, doctors treating high blood pressure often prescribed Norwood's tincture, a medicine derived from American hellebore, a plant so toxic that its main symptom of working was inducing violent, uncontrollable vomiting and dangerous drops in heart rate. Yet drinking toxic potions and dangerous narcotics was only the beginning. When Victorian doctors turned away from liquid tonics and toward heavy metals and surgical blades, things became exponentially worse. It was prescribed for almost everything, but most famously as the primary treatment for syphilis. Doctors believed that forcing the body to heavily salivate and sweat would purge evil toxins from the system. Patients were given liquid mercury, mercury pills, or locked-in steam cabinets filled with mercury vapor. In reality, patients were suffering from severe mercury poisoning. Common side effects included extreme neurological damage, rapid tooth loss, tremors, and total organ failure, meaning the cure routinely killed the patient long before the disease could. If drinking toxic metals wasn't terrifying enough, stepping into a 19th century operating theatre was a nightmare of its own. This was the era of speed surgery, where operations were performed without effective anesthesia or pain control. Speed was the surgeon's primary skill, as finishing quickly was the only way to prevent a patient from dying on the table from shock or massive blood loss. Legendary surgeons like Robert Liston could amputate a leg in under 3 minutes. However, operating at high speed came at a violent cost. Liston famously performed a single surgery with a reported 300% mortality rate. In his rush, he accidentally sliced off his assistant's fingers and slashed through a spectator's coat. Both the patient and the assistant died days later of severe hospital infections, while the spectator died of sheer fright on the spot. Making matters worse, Victorian surgeons had no understanding of germs or sterilization. Doctors wore blood-stained operating gowns as badges of honor, rarely washed their hands between procedures, and used unsterilized tools on patient after patient. Surgical instruments were often wiped on dirty sponges or dirty aprons before being used on the next person. Post-operative infections, known at the time as hospitalism, ran rampant through hospital wards, killing up to half of all surgical patients. Yet physical cutting and heavy metals weren't the only extreme methods doctors used. When Victorian medicine turned its attention to raw electricity and bizarre mechanical contraptions, things took another shocking turn. As electricity captured the public imagination in the 19th century, quack doctors and inventors were quick to turn it into a lucrative industry. Electropathy became a massive health trend, promising that raw electric currents could reboot the human body. Devices like the health jolting chair were marketed to wealthy Victorians as a cure for everything from indigestion to weak nerves. Patients sat in heavily wired chairs that violently shook their bodies while passing steady currents through their limbs. Electric belts, electrified hairbrushes, and even battery-powered corsets were sold in catalogues, claiming to restore vitality and cure paralysis, though most simply caused mild burns and electrical shocks. Meanwhile, extreme health trends reached absurd heights outside the clinic. Desperate to achieve the ideal Victorian silhouette, many turned to the notorious tapeworm diet. Dieters intentionally swallowed pills containing microscopic tapeworm eggs. Once ingested, the parasite hatched in the intestines, consuming swallowed food so the host could lose weight without restricting their diet. While some managed to shed weight, many suffered severe malnutrition, abdominal blockages, and dangerous parasitic cysts throughout their body. Even Victorian high fashion carried a silent, lethal threat. A brilliant, vibrant green dye, known as Paris green, became the ultimate fashion trend for dresses, ball gowns, wallpapers, and artificial flowers. The secret behind that striking, intense colour? Massive amounts of toxic copper arsenite. Women wearing these green dresses absorbed small amounts of arsenic through their skin, leading to chronic illness and skin rashes. Worse still were the garment workers who manufactured them, who regularly suffered from deep skin ulcers, lung damage, and fatal poisoning from breathing in arsenic dust all day. Humanity was unwittingly poisoning, shocking, and infecting itself at every turn. Yet, just when Victorian medicine seemed utterly hopeless, a massive scientific breakthrough was about to change everything. For decades, medical authority insisted that diseases were spread by miasma, a mysterious bad air arising from decaying organic matter. This deep-rooted belief held back scientific progress for generations, convincing doctors that terrible smells, not microscopic organisms, were the real killer. That all began to change in 1854 during a devastating cholera outbreak in London. An English physician named John Snow rejected the bad air theory and decided to investigate the outbreak scientifically. By mapping every cholera case street by street, he traced the contamination back to a single public water pump on Broad Street. Snow convinced local officials to remove the pump handle, stopping the outbreak in its tracks and proving that disease was transmitted through contaminated water, not bad air. A few years later, French chemist Louis Pasteur formally established germ theory, proving that invisible microorganisms were responsible for fermentation, spoilage, and disease. Building on Pasteur's breakthrough, British surgeon Joseph Lister revolutionized the operating room. Lister reasoned that if germs caused infection, destroying them before they entered a wound could save lives. He began spraying carbolic acid on surgical tools, bandages, and directly over open incisions. Almost overnight, post-surgery infection rates plummeted, transforming hospitals from death traps into places of actual healing. As germ theory took hold, the era of toxic patent medicines and heavy metal cures rapidly collapsed. Governments established strict drug regulation boards requiring rigorous testing and proof of safety before any treatment could be sold to the public. It took centuries of deadly mistakes, toxic potions, and horrific guesswork for medicine to finally abandon medieval superstition and enter the modern age. Every clinical trial, sterile scalpel, and safety regulation we rely on today was bought with the lessons of our dark medical past. So the next time you take a modern prescription or step into a clean medical clinic, you can be thankful that we left the toxic, terrifying world of Victorian cures far behind. If you enjoyed this deep dive, make sure to check out our other videos for more mind-blowing stories from science and history, and don't forget to like and subscribe.